Order, order. Before I call the member to move the motion, I will then call the Minister to respond. There will not be an opportunity, unfortunately, to wind because this is a 30-minute debate and that is the convention. But I do understand a number of members have indicated to the member moving the motion that they intend to make an intervention, and she has very kindly agreed to do that. So order, order. Julie Marson to move the motion.
Thank you very much, Mr Paisley. It's a pleasure to serve under your chairmanship. Normally, I might say that it's a pleasure to be here in Westminster Hall to be speaking on a particular issue. But of course, it's not. I wish I was not here. I wish I was not here raising the issue of cancer in young adults, because actually it is an issue which is horrible to confront and horrible to contemplate. But what I feel is nothing in comparison to what Simon and Andrea Brady feel. They have to confront every day the reality of what happened to their daughter Jessica, who tragically passed away on the 20th of December 2020, aged just 27. They are here today because of Jess. I am here because of Jess. My right honourable and learned friend, the member for North East Hertfordshire, is here because of Jess, and the Minister is here because of Jess, and I thank them both for that. Firstly, I would like to pay tribute to Simon and Andrea, who, as I said, are here today. They are utterly determined, in the face of their terrible loss, to effect change in Jess's name. And I hope I can do justice to them and to Jess in supporting their call for that meaningful change. Because we are asking for Jess's law, a practical change designed to save lives. Jess's law would be that after the third contact with a GP surgery about a condition or symptom, a case should be elevated for review. After 5 contacts, it should be red flagged and set procedures and guidelines followed, including a referral to a specialist. We are clear that this should not be a tokenistic exercise, such as a simple, inconclusive blood test and the patient given an all clear. The investigations needed to be thorough and conclusive to make a real difference to save lives. I'll give one to the member for Strangford.
Can I first of all congratulate the Honourable Lady for Hertford and Stortford for bringing this forward. I'm very moved by her plea on behalf of her constituents and understand that. So I want to just probably thank her first of all for her dedication, dedicated efforts and consistently raising the importance for cancer care in young adults, like she's outlined, just like our young constituent Jessica, who the Honourable Lady has spoken about on a few occasions. In Northern Ireland, the Trust, Mr Chairman, run screening tests for certain types of cancer like breast, cervical and bowel. Does the Honourable Member agree, and I think perhaps he's asking for this, that it is time to introduce early intervention blood testing for those with symptoms of cancer to ensure early detection? If you do that, then you can get these things earlier.
I thank the Honourable Member for Strangford for his intervention, and he's of course quite right. Early diagnosis saves lives. And I will mention some of the figures that prove that using technology, using the right processes and procedures during that diagnosis phase is absolutely critical to save lives. And these are real people and real lives. And so I absolutely agree with him. No, absolutely.
Same, excellent getting this debate today. But before she moves off this point, I've done a lot of work, particularly with young adults, but children as well. And quite often with children, bruising, rashes, tiredness is quite often dismissed as, well, that's just children. That's just the way they are. And quite often, and the danger is that those conditions are actually picked up far later than they actually should have been. And we really need doctors to start thinking a bit out of the box and looking at what these conditions could actually be, rather than just saying, oh no, it's all fine.
Thank you, Mr Paisley, and I thank the honourable gentleman for that intervention, because I will go on to say, actually, the danger of not expecting to find symptoms and not expecting to find cancer in children and young adults, and the terrible consequences that delays and misdiagnoses can have, as they did in Jess's case, and can too often be the case. So I do want to talk about Jess, because to understand how important this is and why the Brady family are so committed to this approach, it is important that I tell Jess's story. In mid-2020, Jess was feeling unwell with abdominal and back discomfort. It was during the pandemic, and Jess was given an online consultation at her GP surgery and prescribed antibiotics for a suspected kidney infection. Over the ensuing weeks, she was prescribed numerous other medication, including more antibiotics and steroids. Jess contacted her surgery on more than 20 occasions in 5 months. None of the 4 GPs who provided her with a consultation, 17 of them conducted remotely, took her symptoms seriously. Her requests for blood tests were granted, but a raised D-dimer was dismissed after a preliminary scan and not investigated further. Blood results showing poor liver function were left for a 6-week follow-up review, which proved fatal. She was told for months she was suffering from long COVID, despite 2 negative coronavirus tests. She was finally diagnosed with cancer following a private referral on the 26th of November. Her dependency on oxygen from that date meant she did not leave the hospital or ever return home. Jess discovered that she had stage 4 adenocarcinoma with an unknown primary. It had spread throughout her body to her spine, liver, stomach, lungs, and lymph nodes. Jess was a talented satellite engineer for Airbus and had so much potential and so much life to live. Her loss has shattered her family's world. Devastatingly, had someone taken the initiative to closely review Jess's case, examine the evidence, cancer screening would have been an obvious requirement. A consultant recently said to her parents, if a diagnosis cannot be made from initial tests, then not enough tests are being carried out. For Jess, a request to be referred to an ear, nose and throat specialist was laughed off. Letters written to the surgery listing her symptoms, including dramatic weight loss and vomiting, were ignored. Jess felt powerless and distressed. She tried so hard to be heard and to be taken seriously. It was heartbreaking for her family to watch her deterioration. It is obvious, really, that when people are desperately ill, at their lowest ebb, they do not possess the stamina to fight the system, nor should they have to. And Jess's age was a key issue. Many people, including GPs, just do not expect to see, as the honourable gentleman said, a young adult with cancer, and this affects their diagnostic process and judgment. I will.
Can I join my honourable friend in expressing admiration for the way in which the Bradys have campaigned on this issue? But isn't it really necessary for each general practice to have at least one doctor who is seriously knowledgeable about cancer diagnosis and is able to take a lead, so that if the symptoms are not diagnosed, then they get to look at it and perhaps send it to a rapid diagnosis centre? Because otherwise you're really letting down the patient. And I know that the Health Select Committee said in its report on cancer services that we did need more support for GPs in this area, and does she agree with me? Can I commend her on what she's doing?
Thank you very much. I do appreciate my right honourable friend's intervention, and I will go on to talk about some of those things, because he puts his finger again on some of the most important aspects of how GPs manage their diagnosis process, because the diagnostic centres are fantastic, but they need to have patients referred to them, which goes back to Jess's law and what we're trying to achieve there. Cancer charity Click Sargent have found that around half of young people visited their GP at least 3 times before their cancer was diagnosed. But actually, almost 10% of all new cancers are people aged between 25 and 49, with almost twice as many cases in females as males in that particular age group. Simon and Andrea Brady created a petition in Jess's name, and I and my right honourable friend, the member for North East Hertfordshire, joined them to hand it into Downing Street. Its plea was to increase the awareness of diagnosis of cancer in young adults. It currently has an incredible around 240,000 signatories, and it has highlighted the scale of the problem for young people and young adults in particular. The petition makes heartbreaking reading. Countless other people tell their stories of their young family members who have had their lives curtailed by late or non-existent cancer diagnoses. The disproportionate occurrence of females is also deeply troubling. Being told you are too young for cancer has been happening for years, and it's simply not acceptable. Young people have their symptoms explained away with other diagnoses. Jess, as I said, was told she had long COVID despite never having positive tested for COVID. The explanations given to other patients for poor health are endless: irritable bowel syndrome, pulled muscle, fatigue, stress, migraine, the list goes on. I very much welcome the significant rollout of rapid diagnostic centre pathways across hospitals in England. And I know we've just achieved 1 million tests and scans via our community diagnostic centres, which is a huge achievement and critical in tackling the COVID backlog. But of course, patients, as I was saying, still have to be referred by a GP, and this vital link is what we're focusing on here today, particularly the escalation of patients with undiagnosed symptoms within a GP surgery or to a specialist, as per Jess's law. There are other issues which relate to GPs, however, including having a dedicated GP lead for a patient. The general practice contract requires practices to provide a named, accountable general practitioner to all registered patients. That GP must take the lead in ensuring that any primary medical services considered necessary to meet the needs of a patient, including appropriate referrals to specialist care and liaison with other health professionals involved in the patient's care, are coordinated and delivered to that patient. However, Jessica's case demonstrates that this does not always happen. Jessica was not seen by one GP at her surgery. In her case, 4 doctors spoke to her and prescribed medication. Although Jess was told on one occasion that she was discussed at a practice meeting, it was obvious there was no one person overseeing her case. She was never seen or contacted by her named GP. It is also vital that GPs are required to maintain their continuing professional development by maintaining up-to-date training and awareness of cancer, including in young people. Click Sargent's Young Lives versus Cancer is a charity dedicated to supporting children and young people with cancer and to ensuring that their voices are heard in the context of cancer care. They have identified several challenges faced by GPs which hamper early diagnosis. They include limited training and awareness and time pressures. And of course, the effect of the pandemic is exacerbating existing issues. 1/3 of GPs reported inadequate opportunities to gain experience in the care of children and young people during their initial training as being one of the top barriers to identifying cancer in children and young people. The Health and Social Care Committee's review into cancer services, published on the 5th of April, concluded the single most effective way to improve overall survival rates will be to diagnose more cancers earlier. Diagnosing bowel cancer, for example, at stage 1, means that 90% of people will live for 5 years, compared to just 10% of people diagnosed at stage 4. Of course I will.
Very grateful, and she's making a very powerful speech, and I do apologise, I missed the start of it, and my condolences to Jessica's parents as well. But this point on sort of early diagnosis is absolutely the key point. I'm chair of the all-party group on ovarian cancer and co-chair of the vice chair of the breast cancer all-party group, and I've done a lot of work in this area, and the number of people, and women especially with ovarian cancer, where it's A&E, when they're really, you know, it's almost stage 4 or too late when they're diagnosed, has got to, you know, it's really got to stop. And it all starts with symptom awareness, and the fact, you know, what they're calling for in that petition, therefore, is so necessary. We need, you know, sometimes people have been back and forward to the GP so many times. Would she agree that that is the one thing that I think would have massively made a difference in the case of Jessica?
Thank you, and I very much welcome that intervention from the Honourable Lady, because she's absolutely right. And the work she does in raising awareness on ovarian cancer and breast cancer is all part of that hugely important process. I lost a dear friend to ovarian cancer, and it's a very difficult thing, it's a very unspecific thing to diagnose, to even realise that you might have the relevant symptoms. Breast cancer, I think we've made a lot of progress with, and I just think we have to keep that up. There are different cancers, and different cancers have different symptoms, and awareness of the range of symptoms and how they might impact different people is absolutely key to early diagnosis, self-diagnosis, to actually say, let's go to a GP now, and then to get that GP to then take that forward to identify the real underlying issue is so important. So I thank the Honourable Lady for that. The pivotal role general practice doctors play in diagnosing patients early cannot be overstated. People, our sons, daughters, mothers, fathers, family and friends and neighbours across the board, regardless of age, race, sex or any characteristic, are equally deserving of diagnostic testing and referrals. Patients must be accorded the time, space and physical contact to voice their concerns when presenting with recurrent and progressively aggressive symptoms. Listening and acting is key. I know the Minister is listening. We've met and discussed this issue previously, and her own experience in the nursing profession gives her great empathy and insight, and I look forward to hearing her response in a moment. But I'd also like to take this opportunity to thank my right honourable friend, the Secretary of State for Health and Social Care, who is arranging to meet with Mr and Mrs Brady to discuss Jess's experience and what we can learn from it and how we might be able to implement Jess's law. I'm also very grateful to all of those who have contributed today, particularly my right honourable friend, the member for North East Hertfordshire, who I know stands shoulder to shoulder with the Brady family. And finally, but most importantly, I would reiterate my thanks to and deepest sympathy to Simon and Andrea Brady and their family. We do not want to hear tragic stories such as Jess's, not because we don't care, but precisely because we do. In conclusion, I would like to repeat a detail of Jess's story that I think illustrates in how much regard she was held. On the day of her funeral, a satellite she helped to design was launched into space from Cape Canaveral. It was inscribed with the words, "Thank you, Jess." In honour of Jessica Brady, let us implement Jess's law so that young people, young adults facing the trauma of cancer in the future can also say, "Thank you, Jess." Thank you, Mr Paisley.
Thank the member for that speech. The question is that the House has considered cancer care for young adults, and could I too acknowledge the presence of Simon and Andrea Brady in our public gallery before I call the Minister. Minister Caulfield.
Thank you, Mr Paisley. It's a pleasure to serve under your chairmanship, and can I thank my honourable friend for bringing this debate here. As she said, it's not a debate we want to be having, but it's one that we need to have. And just to offer my apologies and condolences to Simon and Andrea, who are here with us today, because there's nothing that we can say in this debate that's going to make things easier for them. But if we can try and prevent a similar tragedy happening to another family, then we must absolutely do everything we can to make sure that that happens. It is true that there's two factors probably in Jess's case that probably didn't help with her diagnosis. Firstly, that cancer in young people, children and young people, is not as common as it is in the rest of the population. And it's not unusual for a GP or even a GP practice to only see 1 or 2 cases across the lifespan of their service. There's just under 4,000 young adults between 15 and 29 who are diagnosed with cancer in England each year. And so across the country, that is small numbers. And so GPs often don't have the experience of dealing with young people who present with symptoms that are often, as the Honourable Gentleman from, or Right Honourable Gentleman from Allen and Deeside said, are very non-specific and can often be attributed to other causes. I think the other factor is if there is an unknown primary, they are more difficult to diagnose across the board of all age groups because there isn't an obvious breast lump, there isn't an obvious shortness of breath, there isn't an obvious mole that has changed. And so that often makes it difficult for GPs to try and get to the bottom of what's happening. But despite that, it's very clear from Jess's case that there were many opportunities where a further investigation could have revealed what was going on, and she shouldn't have had to go back so many times with the same symptoms without being investigated further. And that's precisely why this government has put a lot of funding, £2.3 billion, into the rollout of community diagnostic centres, so that for those patients with non-specific symptoms that the GPs cannot get to the bottom of, they can refer them straight away. They don't need a hospital referral to an oncologist or to a surgeon to investigate. They can just refer them directly to the community diagnostic centre where there's a range of tests available, whether that's MRIs, ultrasounds, CTs, to try and get that early diagnosis as quickly as possible. If it's not cancer, they can then pop back to the GP for further referrals elsewhere. But if it is, they can get in and get started with treatment as quickly as possible. We're also introducing the non-symptom specific pathways, again, just to do exactly what my honourable friend has said, is to bring together diagnostic equipment, expertise and support, so that there is those discussions happening about a patient who's coming back on a frequent basis where a diagnosis is not helpful. But in addition to that, there are 2 things that the government are really doing, because she's absolutely correct. The nub of this is to try and get people diagnosed as early as possible. The government has now set a target that by 2028, 75% of all cancers should be diagnosed at stage 1 or 2. And to do that, that means we need to be diagnosing people as early as possible. Screening will help, but that wouldn't have helped in Jess's case. But the rapid diagnostic and community diagnostic centres definitely will. But it's about enabling pathways where if GPs are not able to find a source of a problem, they have a route into getting some either expertise or some extra diagnostic tests that will help to do that. Now, to meet that 75% target, that means across all cancers. We can't just do it in the ones that are easier to spot, either because they've got screening tests in place or because they've got more obvious symptoms. That does mean the rarer cancers and those that have no known origin as well. So I hope that gives some reassurance that we are absolutely focused on trying to diagnose people as early as possible. We are also piloting at the moment a nurse specialist route into pathways, so that if someone like Jess was meeting with their GP on a regular basis and still not feeling they were getting to the bottom of their problems, a cancer nurse hotline is being piloted, so they can phone that hotline. If the cancer nurse feels that they need to be seen by a cancer specialist or into the cancer pathway, they can do that as quickly as possible. And again, it's not blaming GPs, but it's another route in for patients to be able to access specialist services. Now, in terms of Jess's law, the Secretary of State is currently formulating the 10-year cancer strategy, which we are looking at in detail, and I can reassure her that children and young people will be part of that. There will be a section on that because there are specific needs for children and young people, particularly around diagnosis, but also around treatment as well. But I'm very happy to discuss that with the Secretary of State, as she has already, around a flag-style system. Now, there may be some technical difficulties around that. I'm doing some work with GPs on a flag system for gun licensing. And the issue that we have from a purely practical point of view is that most GPs have their own independent IT system. They're not part of a national IT system. So if we introduce one nationally, that would be quite difficult for each GP practice to necessarily implement. But I think that certainly some of the suggestions she's made that is not beyond the realms of possibility, to be able to make sure that if a young person is seen 4 times and they're still coming back with the same symptoms, that we cannot introduce a system to make sure that that's raised to another level. And as she said, a red flag level where actually interventions need to be taken place. So many of the points that she's made, particularly around that named GP element as well, are very, very important. And I certainly will be following up with her. And I think the timing of this around the 10-year cancer strategy and including some of this work that she's done in that would be a real opportunity. Certainly give way.
Thank you. I appreciate the Minister giving way. She makes a really important point and about the practicalities and the technicalities of implementing something like Jess's law, and I absolutely appreciate that. But I think the example she's given, for example, about the IT systems being different across different GP practices, maybe illustrates how important it is to have that standardisation in procedure, because patients should not be reliant on whether a GP has a particularly efficient or a good procedure. It should be a standardised practice across the board.
Absolutely right, and that's why we're introducing these non-specific pathways, so that if someone hasn't got a specific clear diagnosis and the GPs are not sure what to do, that there's a pathway to follow consistent across every GP across the country, so that people aren't dropping through the net. And the early cancer diagnosis is one of the specific priority areas in the Core 20 Plus approach, which we introduced last year to support the reduction of health inequalities experienced in the country. And I think it is crucial that we use that opportunity to flag some of the issues that she's raised. But also, crucially, it's important around GP training across the board, because many GPs won't come across a young person with cancer in the course of their practice. There is work being done both by Macmillan Cancer, Click Sargent, Cancer Research UK, rolling out training and regular updates, not just one-off training for GPs, but also for other members of the primary care team. It's much more common now for people to be seen by the practice nurse, the paramedic, the physio, if they've got back pain, joint problems, that may seem like a physio problem, but actually could be an underlying cancer diagnosis. So it's important we educate and keep up to date the whole team and not just the GP. So I'm very happy to take away the suggestions that she's made this afternoon to see if we can put some proper measures in place that will reduce the chances of this happening again. We won't necessarily be able to make sure that no one is missed, but certainly there's some significant concerns that she's raised this afternoon, some flags of her own, that raises some concern with me that we're not where we should be, and certainly that there are things that we can put in place that will stop young people with non-specific symptoms being missed with a cancer diagnosis.
Thank you, Minister. The question is that the House has considered cancer care for young adults. As many as are of the opinion say aye. Aye. And the contrary, no. The ayes have it. The ayes have it. Order, order.